are really moving well. So I'm going to show some techniques now. If Tara will come over here. Go and lay down, Tara. So first thing, always, you want to open up those thoracic inlets. The superior thoracic aperture can be made up of T1, the first rib, manubrium, as well as Simpson's fascia. What you want to do is release that, because any restriction in that fascia will impede the flow of lymphatics. So you just use either indirect or direct. This is myofascial release. You can take a look at our myofascial release video for some more information on this technique. And you just want to make sure that's nice and released. You can also take a complete hold of the entire unit and try to release it that way. Once we have those opened up, we can start, the clog is gone, and we can start draining everything else. So first thing you want to do, you can take a grab the pectoral muscles and just pull. Get a nice release here, and that'll help open this area up some more. So I'll go over a few of the thoracic treatments. First thing will be a thoracic pump. You want to, there you go. Pay attention to any female anatomy and make sure that you have the patient's hands below yours, and take up any soft tissue, because you don't want to just be pushing back on soft tissue. You want to have a good grip of that thoracic cage, get a nice hold, and then you're pumping. You want to aim for a rate of about 100 per minute pumps. Another technique very similar to this, I'll ask the patient to go ahead and look to the right. Bring your hands up here, and this is the thoracic vacuum. So again, I take up the slack, push down, deep breath in, all the way out, and I take up that slack, then deep breath in, I don't allow that out, all the way out, take it up again, then deep breath in, and you let go about a third of the way through the inhalation. Sometimes you can feel like the patient's about to choke on their tongue, but it gets a really good vacuum and pulls that lymphatic flow, get things moving. Then moving on down to the abdominal area, which is going to be the next area. Of course, we want to open up that thoraco-abdominal diaphragm. You can do that, bringing up the legs, relaxes those muscles, aim just medial to that rib cage, and kind of move superior. Then you can use some breathing and some pushing in a cephalad manner in order to release that diaphragm. You can also do, similar to thoracic pump, we have an abdominal pump, which basically you're just moving medial, getting a nice grip below the xiphoid, and pumping in a superior fashion. This one's more of 20 to 30. You're not going to want to be going 100 pumps per minute down here in the abdomen. There's also a liver and spleen quiver. Because I'm on Tara's left side, we can do the spleen quiver. You just want to have a hand on the posterior aspect, come below the rib cage, take a deep breath in, all the way out, and I'm coming down towards the spleen, posterior, another deep breath in, all the way out. I won't be able to palpate the spleen, but once I'm in that area, you can just give a little bit of a quiver. Again, you can do the same thing on the right side, and that'd be the liver quiver. So then moving on to peripheral. Something you can do, another pump. So we have thoraco-abdominal. Now let's check pedal pump. Of course, you want to make sure that the popliteal fascia is released, so you're not just pumping into a closed dam. So you want to make sure you completely dorsiflex, so you're not just down here. This is the equivalent of taking up that slack that we did in the thoraco pump. Take up that slack, and then just pump again. Again, we're aiming for about 100 per minute here, just like in the thoracic pump. So another thing you could do